Welcome to Kenya Talk Sex. Today we're going to talk about contraception.
Hey guys, my name is Ruth Wairoi and we're here to talk to you about the misconceptions on contraceptives, so stay tuned. Contraceptives are substances people use to prevent pregnancies.
Contraceptives, I think, are mostly the safe way. It's a really safe way to avoid diseases like AIDS and early pregnancies.
A contraceptive is used to prevent unwanted pregnancies.
I can't really put the right English words for it, but I know it's what you use to control birth and stuff.
Contraceptives, to me, basically, I use them to help me with my, my cramps, but it's for family planning.
A contraceptive. I know examples. I don't know how to describe it totally, but I know different examples. You can use for mainly birth control and stuff. So I know the pills. I know the copper IUD. I know condoms. Everyone knows that.
I know a couple of contraceptives. I know there's a bandage and there's one that closes the fallopian tube, and there's also another one that you take pills every day.
I know they're birth control pills, and I've heard a lot of myths about them. One of them being mood swings. People say that if you take contraceptives, you get moody.
Contraceptives can prevent maybe AIDS or STIs or STDs. Contraceptives make you fat, which is true because it depends on your hormonal level. That you can use contraceptives from a young age. Contraceptives make you infertile if you use them when you're from a teenage year to when you grow up.
There's this misconception of the injection that chicks get fat and they get scared that they'll get fat and all, and I don't know. And for the P2, things like, you might diarrhea or vomit, those kind of things, yeah.
If you take the pill, if you take it, you're going to be infertile forever. You're done. You and kids are done forever.
The one misconception that I think I've heard is that some people think that a contraceptive can reduce your chances of getting STDs and HIV, which is not true.
I heard there was a myth about contraceptives where if you start taking the pills, eventually there's a long-term effect where you won't get pregnant or your uterus gets messed up. But after consulting, I realized that actually that doesn't happen. That contraceptives it's actually safer than condoms. So I guess that's a myth, but that's something I actually used to believe in.
They are good, but it also depends with the medication or the prescription, because we are told that you have to go to the doctor first so that you can know what contraceptives are good for you.
Number one, very important. In a day and age where people are more scared of pregnancy than of HIV/AIDS, I think contraceptives are very important. Plus, with the economy, you don't want 10 kids.
If you're having safe sex, then that's actually pretty good. As long as you're using them, they even, most people don't understand that contraceptives are an important thing when it comes to relationships, especially if you're sexually active.
I don't think there is anything wrong per se if somebody is using it in the right context, like it's somebody who is married, for family planning issues, and somebody is using the recommended dose. There's nothing wrong with that. But if it's a very young person like myself and I'm using the pill, that brings some sort of imbalance to the hormonal system. So that means that by the time I want to become a mother, it may be an issue.
I think you should be independent. As a woman, you should know what you want to use. But I think if you're in a relationship, you and your partner should decide on what form of contraceptive is acceptable for both of you. And for guys, I think guys should actually want to use contraceptives. Should want their girlfriends to use contraceptives.
I know that sometimes they do go wrong, mostly if you don't follow the right procedure when it comes to pills. But I believe if you can't abstain, then definitely go for contraceptives.
Lydia Winder, RVCT counselor. Yes,
Okay, my name's Patrick Foley. I'm a clinical practitioner at USIU for the last 2 years. Contraceptive is any method, either hormonal, non-hormonal, that is used to prevent pregnancies.
A contraceptive is anything that prevents a lady from getting pregnant, just from the term contraception. They work differently, but basically what they do is to prevent an egg from being fertilized by semen. Yeah, so that happens in the uterus. We have different methods of contraceptives. We have the hormonal ones that are taken. There's the oral one, there's the injectable one. We have the patch. We also have no plant, which basically are hormonal and they play around with the hormones. And then we have the barrier methods, where we have both male and female condoms. And we have cervical cup, we have the diaphragm, and we also have what you call IUD, which is intrauterine device. So basically what they do is that they prevent semen from going in to fertilize the egg. And then we have the natural methods, where we have withdrawal, we have safe days. Basically nothing is used in this case, but we just use the natural ways, like your body, how your body behaves to be able to prevent one from getting pregnant. And then we also have the sterilization methods, which are permanent methods. These ones are usually used by people who have enough babies or who don't have to have any more babies. And here we have tubal ligation in women, and we have vasectomy. So only two contraceptives can prevent pregnancy and also prevent one from getting STIs, including HIV, and those contraceptives are called dual protection. The only dual protection contraceptives that we have are abstinence and condoms.
Mostly infertility and growing big, which varies according to the people, because there are some clients who give them hormonal contraceptive. They'll be very good, they'll never gain weight, their blood pressure will always be normal, they'll have no any side effects, and even when they want to be fertile, once the contraception is removed, they get fertile in time. Then there's another class of people. These ones, once they start on the contraception, mostly hormones. Hormones are the ones which affect. This person may start gaining weight, the blood pressure will start going up, will have specific types of effects, complaining dizziness, headaches all the time. So those are the most common. Infertility, rarely we look at that, because that's why it's advisable before you start on contraception. It's good to see a medical personnel so that they advise you on the various methods. So far, none so far, because most of the effects, they are not done depending. If it's affecting your blood pressure, therefore the contraception is removed. Is stopped immediately. If it's making you gain weight, it's stopped. Then another contraception is chosen, the right one for
you. This depends a lot on the age group we are talking about. If you're talking about the youth, if you're talking to the youth concerning contraceptives, as young people, I would highly advocate for abstinence or continence, because as a young person you don't have a family and you wouldn't want anything to interfere with your ability to get pregnant in the long run. Now when it comes to families, when one feels they're ready to be on a contraceptive, it's very important for them to go to a family planning specialist or a physician specialist in this area who will take history, because it's also important to take history. For instance, people who have breast cancer in their lineage are highly advised not to use the oral contraceptive, because it could increase one's chances of getting breast cancer in the long run. And we also have pressure that also has to be checked. And we also have some physical features that have to be checked. You know, there are cases where if someone has some physical features on their body, they're not supposed to use like hormonal contraceptives. So basically, if they must use it, they have to go see a specialist who will do the testing.